Welcome to the Central Peninsula Hospital Surgery Coordination Center Education Series. My name is Greg Motanaga, and I am a physician here at Central Peninsula Hospital. During this slide presentation, I am going to discuss important information about blood transfusions. Except in rare emergency situations, giving blood products to patients requires informed consent. This educational module is intended to give patients or their decision makers the information needed to give consent for a transfusion. Included with the consent form is the blood products patient information sheet. We recommend that you review this form prior to signing the consent. It will be a good review of what is covered here. This program will cover the following. What is a blood transfusion? Why might someone need a transfusion? What are the risks and benefits of a transfusion? And are there any alternatives? A blood transfusion is when blood products are donated from one person and given to a different person through a vein. There are several different types of blood that patients can receive depending on the situation. Red blood cells come in a bag of dark red fluid. Red blood cells carry oxygen and help to remove waste products from your body. Plasma is the liquid part of your blood. It is a yellow color and contains many substances that are important for clotting. Platelets are small, colorless blood cells that come in a bag of yellow fluid. Platelets help your blood to clot properly. The particular blood product, such as red blood cells, platelets, plasma, and the amount of blood product transfused, is a judgment that a doctor will make based on the clinical situation. Let's talk about the risks of a blood transfusion. Blood transfusions are generally considered to be safe, but there are some risks with transfusions. We'll talk about each of these briefly, starting with infection. Blood may contain bacteria, viruses, or parasites. The risk of acquiring these infectious diseases from transfused blood is very low. However, if acquired, some of these can be severe or fatal. Blood banks screen donors and test donated blood to reduce the risk of transfusion-related infections. Infections such as HIV or hepatitis B or C are extremely rare. This slide shows the risk of being exposed to these infectious agents. These rates are included in the patient information sheet. There are several types of transfusion reactions. A hemolytic reaction occurs when your immune system rejects the blood cells from the donor. This is exceedingly rare and is usually attributed to a clerical error. A febrile reaction is when fevers or chills occur during a transfusion. This is the most common side effect and can affect up to 1 in every 100 transfusions. TRALI, or transfusion-related acute lung injury, is a rare but potentially deadly syndrome when the lungs fill with fluid and oxygen levels decrease as a result. TACO, or transfusion-associated circulatory overload, is a reaction when the fluid from the blood products is too much for the heart to handle, and the extra fluid builds up in the lungs, causing breathing problems. Metabolic toxicity occurs when the blood products alter your electrolyte balance or when additives in the blood accumulate in your body. This is more of a risk to newborns or small children. Transfusion-associated graft versus host disease occurs when transfused white blood cells attack your bone marrow. Although this is usually fatal, it's much more likely to affect people with severely weakened immune systems, such as those being treated for leukemia or lymphoma. Iron overload can happen primarily in children who are receiving repeated transfusions over time. Mild allergic reactions can cause hives, itching, and fever. Very rarely, anaphylaxis can occur. There are alternatives to a blood transfusion, which include medications, volume expanders, growth factors, blood salvage, and autologous blood. But when there is a time-sensitive need to receive blood products, there are not many good alternatives to a transfusion. Without enough red blood cells, vital organs including your heart and brain can become oxygen deprived, which can result in permanent and even lethal damage to these organs. Without adequate clotting agents, such as platelets or fresh frozen plasma, a patient can have severe, uncontrollable bleeding. Please tell your healthcare provider if there have been any adverse reactions to a blood transfusion in the past. Speak with your physician if you have any additional questions. Then please sign your transfusion consent if you are willing to accept blood products. Thank you for your attention during this educational module on blood transfusions.